But I wanted to share with you some of the wins that we have had in Tennessee. We've had some good wins. And I can't remember how maybe Dr. Barron or Dr. Reagan characterized it a few minutes ago. It is incremental, but it is trending in the right direction. And that is certainly a win. Now, we all know that the pandemic, for a lot of different reasons, for mental health reasons, for economic reasons, for societal reasons, threatens to halt our progress or at least slow it down. And so I know that's concerning to us all. But because of some regulatory changes, because of some oversight, particularly CSMD, as well as a lot of education, and I know that's what this group focuses on, we have had decreasing prescription opioid rates in Tennessee. In fact, from 2018 to 2019, every single county in Tennessee, all 95 counties, have had a decrease in prescription opioid prescribing. That is a big win. But we also know that we're not dealing with just an opioid problem. We're not dealing with just a prescription misuse problem. We're dealing with an addiction problem. And so when you're dealing with an addiction problem, when you squeeze the balloon in one spot, it kind of, it expands in another one. And that's what we've seen with illicit substances, particularly fentanyl, and as well as stimulants, methamphetamine and cocaine. In our drug overdose deaths, over half of them involve fentanyl and 44% involve stimulants like methamphetamine and cocaine. And so unfortunately, we've seen our drug overdose deaths increase by 15% from 2018 to 2019. And certainly when 2020 numbers are finalized, the preliminary trends that we saw do indicate that we're going to see a continued increase. The other thing that is concerning to me, and I know many of you within the sound of my voice would feel the same way, is the disparity that we are seeing amongst the Black and white communities. While the rates have gone up across all races, there has been a really sharp and disproportionate increase in our Black population from 2018 to 2019, which is duly concerning. Talking about the pandemic, so many factors have gone into what we saw both in fatal and non-fatal opioid overdoses. The non-fatal opioid overdoses have increased 22% from 2019 to 2020, and hospitals report in the summer of 2020 their highest ever non-fatal opioid overdoses. There were a lot of factors involved in that, and I'm interested to see when it all shakes out and when we can look back at some final data. We saw a big spike in overdoses after the first round of stimulus checks. And we also know that, so this infusion of cash, as well as some interruption in supply chains, adulterated product, if you will, that led to increased overdoses and higher numbers of deaths during the pandemic. So what are we doing about it? Well, all of those things that we have been doing, that have been working, are being continued. Obviously, the regulation and the oversight, and certainly the education. And this group is a force multiplier when it comes to that. But also, we're just making some practical daily changes within the department in our efforts surrounding both surveillance as well as prevention of overdose. So, and it takes a multi-pronged approach. It's not just one thing. And we're pursuing both state action and federal action and funding to address that. So on the state perspective, I'm sure nobody is all that excited when the state budget comes out, but it's a really big day in state government. And so I think that day was maybe last Tuesday or Wednesday. And in our Department of Health budget, we were granted the full request of $250,000 for our Office of Informatics and Analytics. That's where our surveillance folks are. And so they're going to upgrade their system to have enhanced surveillance so we can make sure we monitor and analyze the data appropriately. Also, I know you all are familiar with the CDC's Data to Action grant. And so pursuing that in a lot of different ways. And I wanted to highlight some of those for you. One of those is building multi-sector partnerships around substance abuse. And it really, I mean, we're all familiar with sort of a multifaceted approach. We've been doing that in the child protection world for years. It makes perfect sense, and kind of it's already been done at a grassroots level, but more formally bringing people together, treatment providers, law enforcement, medical, clinical professionals, school personnel, bringing to the table to assess the resources that are there. What have we got? What do we need to get, whether it's grant funding or some type of personnel resources, and then get a plan that works for all, and then work that plan and implement that and oversee it. So that's one of the big efforts that the Data to Action grant actually requires, but is a best practice. Another one of those is almost like, well, it's not almost, it is an outbreak of opioid overdose. And so when we see those outbreaks, we can identify them and respond urgently. Now, you know, the word outbreak means something different. Now, I'm not sure it's so different, but I mean, people talk about outbreaks now, and people understand sort of that mentality of, oh, there is a hot spot. And I don't think people, the general populace, has ever really stopped to consider, what does an opioid overdose outbreak mean? But that's something that we're putting on the radar and using mapping and surveillance and other tools, very similar to like what we did in an infectious disease outbreak, to look at the factors surrounding an outbreak and to look at those causative factors and be able to address those. Other things in this grant include community substance abuse prevention education, of course, something that we've done and will continue to do. Reducing neonatal abstinence syndrome rates by access to family planning. You can't have neonatal abstinence syndrome in your baby if you're not pregnant. And a lot of the mothers with babies with NAS, a high percentage of those have unintended pregnancies. So we want to be able to have appropriate access to family planning services so women can bear children when they're ready and when they're healthy. Otherwise, integrating public safety initiatives, pre-arrest and pretrial diversion, targeted naloxone distribution, and MAT in correctional settings. Quick personal note about that. So many of you know that prior to my role as commissioner, when I worked with rural hospitals, I was also on the board, or actually still am, of Aspel Recovery Center in Jackson, which is a nonprofit residential treatment center. And part of our work, and I tried to bridge the gap between that work and my rural hospital work, we converted a former rural hospital into a residential treatment facility for pregnant women struggling with opioid addiction, and then they could bring their babies back. One of the hardest parts there was a lot of our clinicians didn't want to initiate MAT treatment or MAT services in women who were involved in the criminal justice system, because if they violated their probation, they couldn't get access to their MAT if they went back into an incarcerated setting. That would obviously be very dangerous for both mom and her unborn baby. And so when we really target and be able to provide MAT in correctional settings, it has broader implications than it might just seem on the surface. So that's just a short list of the things that the Department of Health is doing. It's something that's very top of mind for us, and that is in no small part to the work that Dr. Reagan started when he was at the department. And so I wanted to get with you today and tell you about what an important focus it is for us and how very proud and supportive we are of the work you are doing. If there is anything at all that we can do to support or further your work, I hope you will reach out to us. Thanks again, Lisa.